My name is Laura Pellicer, and I'm a digital producer with WUNC. The coronavirus pandemic has dramatically transformed so many of our lives in just a few short weeks. We are suddenly turning living rooms into offices, we are turning kitchens into classrooms, and we are spending a lot of time with the people in our households. For many of us, these are all new sources of stress in our lives. We reached out to a licensed clinical psychologist for her advice about how to stay mentally healthy and strong during this really challenging period.
I've heard from some of my colleagues that they are seeing a spike in cases of panic attacks, and that totally makes sense because not only are we experiencing the anxiety of the moment with uncertainty, with perhaps loved ones getting sick, seeing our friends getting sick, being afraid for our own health, the economy falling apart. All of these are really good reasons to be experiencing anxiety. The great thing about the human body is that it lets you know. So stress, you'll feel tension in your shoulders, you'll get headaches, you'll feel maybe a little bit short of breath. With anxiety, you might have raised heartbeat, you might get sweaty palms, you might just feel really tense and uncomfortable, you might get hot. All of these signs are really, really clear because your body really wants you to respond to it. If you find yourself kind of going down a rabbit hole with worry and starting to slide into unhelpful ways of thinking and stressing out about things you can't control, then just quickly notice that you're doing that and then quickly do something with your body. Go take a shower, go outside for a walk or a run, do a few jumping jacks, put your face in the sun, get a little bit of exposure to sunlight. And that's a good way to sort of reset the system. So if you are living in the same household with other people, make sure that you all have some me time in your own separate space and be really disciplined about, if you're working from home, these are work hours with these breaks, or this is after work, this is when we hang out, instead of sort of trying to impinge on each other's space all the time. And at the same time, we do want to very actively reach out to friends, to FaceTime, to schedule video conferencing with coworkers, email, text, stay connected with people. Even introverts need that. I would really advise limiting to one or maybe two really reliable sources of information that you can trust. For example, going to the Center for Disease Control or the World Health Organization for official information about coronavirus, instead of watching the news, watching that scroll of the death toll, of the number of cases climbing, because those numbers don't offer any practical solutions for us individuals on a day-to-day basis. So maybe once or twice a day, you set your alarm for 10 a.m., I'm going to check the news on coronavirus, and then the rest of the day, stay away from it. All the factors are working against us. We're kind of shut in, our schedules are all wacky, and sleep can be really challenging at this time. Basically, try to really make the difference between day and night really clear for your body. So get dressed in the morning, get out into the sun during the day, have your blinds open during the day. And at night, turn off the electronics, turn down the lights low, and, relax. So if you get a couple bad nights in a row, don't sweat it. Your body is really resilient. Your sleep is really resilient. It will reset if you just follow that consistent schedule. Don't just roll around and go straight back to sleep, because then you'll roll back into that nightmare or roll into a new nightmare. Get yourself all the way awake, go to the bathroom, get a drink of water, give yourself a shoulder rub, become fully awake, and then go back to bed and sleep again. And if you're having repeated nightmares throughout the night, just give up on sleep for a few hours. Go and do something else pleasant, relax. It's okay to miss a couple hours of sleep.
If you're experiencing anxiety or depression, you are not alone. Take cues from your body. Try to separate work from play. And if you need more help, Many licensed professionals now offer counseling over the phone and online.